Hey everybody, welcome back to the Business of Wellness podcast. I'm your host, David Guttman. I have a really exciting guest today, a friend and someone I'm in business with now, Dr. Richard Handley.
Thanks for having me, Dave. It's such a pleasure to be here, man.
So I was really excited for the conversation today. Some of the things we've been exploring together on the wellness and biohacking side. One of the things that I think that with people like Dave Asprey and Gary Brecka and Brian Johnson, who's Brian Johnson spending I think he says he spends $3 million a year. He's got a team of 30 doctors or something like that, he's measuring 205 biomarkers every few weeks, it seems like, trying to do the biohacking Olympics or whatever. Mm-hmm. And that's great if you're Brian Johnson and, you created Venmo and you made $400 million.
Yeah.
But for just about anybody else, to be able to really maintain their level of, health span, not just lifespan, mm-hmm. It just seems like it's such a difficult thing. Coming from the medical, field yourself and having been, trained as a doctor, how do you view that, and where do you see things moving?
That's a great question. So let's back up a bit and just quantify my credentials. So, because this leads into the why. So I began my medical career in my late 20s. I went to USC PA school. So I started as a PA, physician assistant, physician associate now, back in the day, before biohacking was a thing. And I was involved in emergency medicine, family medicine, trained, got a master's degree in family medicine, served in the Navy as a naval officer doing primary care, urgent care, and emergency medicine on board a ship, on shore as well at NTC, Naval Training Center down in San Diego. Having the time of my life is great as a PA, but, standard care, we were doing family medicine, with service members and their families in the emergency room on board the USS Constellation, which is a big aircraft carrier. So I got to see, traditional medicine in multiple contexts within the military, which is very niche. But, same medicine in the Navy than what you see, in the civilian sector. So I got this, smattering, a broad general scope of how things are done, and learned things very traditionally. USC, is a phenomenal medical school. And so, in the primary care PA program that I graduated from, it was just, drink from the fire hydrant, every subspecialty, rotating through every subspecialty during my clinical rotations, and going broad, and not necessarily as a PA, going super deep like I did later as an MD in medical school. The first 2 years is all academic. You go super deep into the biochemistry as an MD. You get a lot of biochem as a PA prior to getting to PA school. You spend 4 years undergrad. So that training, it has been ingrained in me from a very early age. This is going back to my late 20s. And so, and spending a lot of time in, outside the Navy in clinical context, seeing, I don't know, probably 50,000 patients in my career or more.
Wow.
That's a guess right now, but it's a lot of patients. So in a lot of them in primary care medicine, using standard pharmacy, pharmaceuticals, integrating with big pharma. I remember, big pharma coming to our office often and saying, "Hey, try this anti-inflammatory, try this antibiotic." And we were, that was just part of the culture, and that's how we rolled. And of course we had some training in nutrition and lifestyle modification, but it was, enough to barely move the needle. And that's how we rolled for a long time. So personally, I've always been an enthusiast, fit and doing things to kind of keep myself in shape. And I've always avoided the things that can kill you easily, like, well, with the exception of like riding dirt bikes when I was a kid, and building tree houses with no ladder. It was insane when I was a child. I did some pretty stupid things as a young guy, but I was a martial artist. So that kind of ingrained in me this sense of personal discipline and, physical, an understanding and feeling of what it's like to be in my own body, what feels good and what doesn't feel good. I've avoided smoking my whole life. I don't drink hardly at all. I never really have drank that much. Avoided, chemicals that, drugs and things that will obviously mess you up. And then trying to eat as healthy as I can. But it was, it wasn't really placed on any hard scaffolding, that I gained later in life through just personal desire and curiosity.
But the background, like, so for me, the way, again, I know probably a tiny fraction of the biochemistry that you do and all the medical training that you've had and the tens of thousands of patients that you've seen. And even with my relatively limited knowledge, the the number of things that we've been told by the medical community that is just fundamentally wrong, and not only just the medical community, but I would say institutions broadly, everything from the food pyramid being completely wrong, the studies on statins and and seeing how some of that information has been biased. Some of the stuff I did in my own research about some of the SSRIs and how some of the research now how they put their thumb on the scale. Most people don't realize in order to get a drug FDA approved, you need 2 studies that have a statistically significant, improvement over the placebo, right? But the ways that you're able to put your thumb on the scale, where they have like a pre-trial period where they throw people out that respond to the placebo, or all kinds of games. And by the way, they could do 50 studies, and 48 of them could have no result, and 2 of them do, and they get a drug FDA approved. And so I just think there's so much noise there. Things like Vioxx that killed how many people, and that drug was on the market for how long?
Yeah.
No one really goes to jail. It's crazy.
I know, it is crazy. I prescribed that drug a lot as a PA when it came out, and it did wonders in terms of like anti-inflammatory effect and, helping people with chronic like osteoarthritis. It was awesome. I was like really excited about that drug. And I remember the drug reps coming in and saying, hey, this is the next best thing to sliced bread.
Right.
And it worked. And I was just lucky. I don't know how many prescriptions I wrote for it, but I'm going to guess in the order of magnitude of maybe a few hundred prescriptions over a couple of years. I think it was out 2 or 3 years, maybe longer. Don't quote me on that. But enough to be, in that mix of like finding a patient with a bad outcome, somebody having a heart attack. I did not, fortunately, many of my patient population had that kind of untoward outcome. But, in retrospect, seeing that all go down, and that's just one of many drugs that I saw kind of flame out for, when you get into, sure, you might study something in, 1,000, 2,000 patients in, your phase 3 clinical trial and see, very little signal, if any. And then you get into a mass population and you're like, oh, wait a second, there was a signal that we did not see. To me, that's really interesting. That also folds back into what we're seeing now in biohacking, right? So we have a sea of anecdote, people making broad claims about peptides. And there is a lot of research with regard to some peptides, but we don't have the massive, double-blinded placebo controls that we get from pharmaceutical companies. So this is, give and take. It's like, are we going to hang our coat on peptides, with anecdote? I would say maybe. The research is still, pending. We certainly see a lot of positive outcomes with regard to that, but we don't have the robustness. I mean, I wouldn't want to throw the baby out with the bathwater when it comes to pharmaceutical companies doing good work. Yes, there's certainly massive bias there. They're motivated, oftentimes by the financing behind it. They're putting billions of dollars into these research studies, and there have been cases where people have kind of fudged the numbers a bit. The peer reviewers are only given so much information. They're not given the broad scope of what's at stake. And so they make decisions based on what they're given, and those aren't always the right decisions. But on the whole, I would say that, medicine has done a good job. When I crash my car, and I have a broken tibia, I don't go, hang out with Gary Brecka. As much as I love Gary, I'm like, hey, Gary, fix my broken tibia. He would agree with me. Yeah. He would say, dude, there's an ER right down the road. The doc is trained really well. He's going to get the orthopod to come in and consult on you, put a pin in your tibia, and you're gonna be good, right as rain in 6 to 8 weeks. There is a lot to be said for, medical training takes a very long time. I'm trained as a PA, trained as an MD. I'm not licensed as an MD, I'm licensed as a PA. As soon as I finished medical school, I continued my training as an executive. I wanted to go deep on leadership prowess. So immediately upon graduating from medical school, I went to Harvard Medical School, got a master's in healthcare quality and safety. When we talked, ad infinitum about these issues of safety and what it feels like to get quality care in these institutions, and that translates into the environment that you and I are about to talk about today.
Well, the thing about it is, right? There's so little data. I mean, you see this in the supplement space in particular, right?
Yeah.
Where and I forget the statistic. I think it's 80% of the supplements that are tested do either have ingredients in them that are not on the label,
Yeah.
or don't have the ingredients
Yes.
in them that are on the label to
Totally.
like a significant degree, right? So it's like someone says, hey, take creatine, hey, take, vitamin D3 with K2 or whatever it might be, or magnesium.
Yeah.
You don't even know that it has the things in it that it says it does.
Yeah.
Like the process, it is so difficult to unravel everything that's necessary for that person. You're 60, I'm 59. I mean, my God, you look 40. But my point is that it's so difficult to unravel all the things necessary to try to do the things that everybody wants. And there really is, in my opinion, there's no easy way to find someone to be your quarterback, to basically do for what Brian Johnson has a team of people doing, but have it done for you and have it done for a way that's customized both to your exact starting point from a set of really thoughtful, testing and protocol all the way through whatever your goals are. Everyone's goals are going to be different. They might be different, at 40 than they are at 50 than they are at 75. And at the moment, there's no way to do that. There are some, what I'll call poor man's versions, even though they're expensive, right? Like some of the stuff that Tony Robbins, and don't get me wrong, I think that stuff's not bad by any stretch of the imagination.
Yeah.
But the problem is it doesn't really solve the problem because it's not, you're having your blood work done, but it's not truly customized. It's because they're trying to do it at scale. Whenever you're trying to do something at scale, you're going to sacrifice the granularity necessary, I think, to move the needle in at least like the way I would want to, or the people that I know that have the financial resources to do it the right way.
Yeah. No, that's a really great point. Case in point, so Function Health, amazing company. Mark Hyman is one of my heroes. I love Function. I've actually gone to their website. I'm a part of Function. I get that blood work done a couple times a year, as does my daughter, as does my wife. It's great. It's access, right? And it's knowledge in your own hands. I am also a trained clinician. So I have the benefit of knowing how to make sense of that information. It's not coming to me in like hieroglyphics and, and I'm left in a lurch trying to read an AI algorithm, that's spit out to me through their system. I'm able to make really deep sense of it and contextualize it and know that, okay, I probably should go into this subspecialized category and order this test over here for my own sake because of my risk factors. But the general populace is not going to have that insight. They're not going to know what to order and what to do with it. And so they're kind of lost, and at least at this point, I'm sure they're buttoning it down. But at this point, it makes it really tough for people to kind of navigate that, and they potentially get lost in the sea of information. So I think with the thing that you and I are putting together, we're going to help solve that. And because we're dealing with a very specific, narrow demographic, somebody who can afford that testing and more, go even deeper, granular to the point of like seeing the inside of your arteries in exquisite detail, looking for cancers, doing things like the Grail test for liquid biopsy. Although you'll see that lab work in the context of Function, we're going to have physicians on our team that are very, very well trained at knowing how to not only tease out the granularity and the risk factor, but how to go down the rabbit hole to the nth degree with our patients, where any question asked, you're going to get multi-pronged aspect, both from conventional medicine and from functional medicine, and allow, and thus giving our patients the understanding and the consent to, go down the path that they choose, and the ability to go down the path in any direction based on the clinicians that we surround them with and our philosophy.
Well, let's talk a little bit about genetic testing, because when I used to think about 23andMe before they went out of business or any kind of genetic testing, it was like, hey, maybe they can tell me that, I have a higher propensity to get Alzheimer early, I'm like, well, do I really want to know that? Maybe it's better not to know, whatever it might be. Yeah. That's about as much thought as I gave to it.
Yeah.
But now the genetic testing and the things that it can help, mitigate, not just, things you can stave off by the right diet, exercise, nutrition, sleep, but also things like, I can't remember but there's a couple of alleles where you have these certain genetic components. I think it's 40% of the population can't process, was it niacin or something like that? That has all these downstream effects that if you don't know that, you're gonna have a lot of issues, all of which could be avoided.
Yeah, exactly. You described APOE,
Right.
ApoE4. which has 1 versus 2 alleles, right? So if you get 1 allele, you have like a 3x chance of getting Alzheimer's disease in your later years. You get both alleles, that goes up to like 8x or more, 8 to 12x. It's a substantial risk. And people are asking themselves before they do that test, do I want to know that information? Do I really want to know? And guys like Peter Tia would argue, you do want to know, because we know enough now to move that needle, to make a change and push that off, into the distance. Peter talks about the marginal decade. If you don't know, you're less apt to make lifestyle changes that really do affect that outcome. Things just as simple as how much sugar do you eat? How do you, how much cholesterol do you intake into your body? How much do you exercise? How do you sleep? Some very basic levers that you can pull on that will really make a massive impact. And there's, of course, a lot of research being done in the areas of, stem cells and a whole host of things that will work, in the deep recesses of our brain to kind of slow that process down and reduce those proteins. Me personally, I know that information about myself, but it was a little scary. Before I got the results back, I'm like, here we go. This is like Pandora's box.
Right.
I hope it's good news. Could have been bad, right? There was one thing that came back in my 23andMe. It was propensity, a slight chance of getting hemochromatosis. My grandfather had it.
Right.
And it came up on my 23andMe. I'm like, oh, that's interesting. But it was one allele. It wasn't both, and it's a low probability. I don't smoke. My grandfather did. So there's a low probability that I'll get that later on. But I'm watching my hemoglobin hematocrit, and I'm not worried about it. But it's could have been something else, a little more concerning.
Well, let's talk about the other thing. I think that there's been a lot of progress on that. I think again. So I've actually had 2 gut biome tests, Viome, and I think the other one was called Gut ID. And I got the reports back. And again, I don't have your medical background, but I'm like, I don't know what to make of any of this, quite frankly. And I probably could feed it to, ChatGPT, and maybe it would tell me the right thing. Though sometimes it hallucinates without having a medical quarterback.
Yeah.
Right.
Yeah.
I'm just not going to feel comfortable.
Yeah.
And at least what I've been told, and I'd love to hear your thoughts on this, is that you're being able to identify early stage, things like prostate cancer way better from a gut biome test than you are even from a PSA test. Maybe it was colon cancer. It was either colon cancer or prostate. I forget which one. Okay. It was one of those 2.
I'm not sure, to be honest about that. Yeah, I've not heard that stat. Yeah, you can go deep on PSA. There's the 4K, which is a PSA study that goes super deep. Pulling in different factors to assess, prostate cancer risk. That's a really cool study. I did that. But in terms of gut biome and its relation to prostate cancer, maybe there's literature out there, but I'm unaware of it, unfortunately. Yeah.
What about the other one? I had gone to this biohacking conference in Miami. This is probably back about, it's a little bit before the CryoCon one that you and I met at. But they had a guy who was a cardiologist, and he was talking about the Clearly test, where basically it's showing you not just how much plaque you have, but how much of it's soft and hard, and obviously very big difference on how much of it's being soft and hard. Yeah. And he also had mentioned there were these two alleles that if you had both of them, he said something like, I think it was 96% of people that they're all the cardiac related issues significantly decrease on a ketogenic diet.
Interesting.
He said, except if you had these 2 alleles, 4% of the population have them, that the ketogenic diet actually does the reverse. It actually causes all kinds of problems.
Interesting. Wow.
And so it's like, and this guy was interesting because he had said that he had been sort of your traditional cardiologist for 15 years, had a thriving practice, but learned a lot of this stuff, saw the Clearly, test results and stuff, and completely restarted his practice. That it took him 2 or 3 years to get back. But I was so impressed with this guy.
That's incredible.
I was like, man, if I had a cardiac issue, that's the guy I want to go to.
Yeah.
But so I'm curious about your opinion about, related to that, there are a lot of new things like stem cells, like you were just mentioning before, like the blood filtering and things, the things you can do to reverse some of the toxicity, whether it's the microplastics or, pesticides or all the other things.
Yeah.
What are the 2 or 3 leading things that you've seen that you think there's really strong data to support some of the stuff they're doing, like the blood filtering and things like that.
Oh, great. Let's start with what we do know. The science is super robust. Going back to, you mentioned the Clearly study. So
The scans.
yeah, so I just had a Clearly scan last week. I went in and had it done. A week and 2 days ago. I'm getting the results are in. I'm going to get them tomorrow. So I don't know. So I wish I could talk about it.
Have you had one before or no?
This is the first one.
Okay.
I've had calcium, CT calcium scores done ×2. I have a little bit of calcium. I was measured at 23 back in 2022, and which puts me in the 49th percentile for risk for someone my age. And so, I'm not too worried about it. It's in my left main stem, which is typically where you see heart attacks, the widowmaker. But again, that's only calcified plaque. It's not. We don't know what the soft plaque burden is, but there is some coronary artery disease in my heart, a small amount, right? It's a pretty low number, but it's not zero. So there's something going on. So this time, rather than get another CT calcium score, I decided I'm going to do a Clearly, CT angiogram. So went in, they inject you with, contrast. My blew out, actually, my right arm, they blew it. They missed the vein, and I had a bunch of, well, not a lot. I caught them before it got too bad, and it was resolved in a couple of days. But anyway, long story longer, they injected in my left arm and got a really clear picture of my heart. And I'm going to know definitively tomorrow, what does that look like? Do I have soft plaque? If so, to what degree? Is it unstable plaque? So that's the kind of granularity you want, and that's going to stratify my risk, and it's going to allow me to, figure out what do I need to do to mitigate that. I'm already on. You mentioned statins. Okay,
Right.
I'm on a statin.
Right.
I know the controversy surrounding it, but I know my family history. To me, my mom had a heart attack in her 50s. I have a positive LP(a). So 20% of the population has an LP(a) problem. And that is an independent risk factor for coronary disease. So based on my risk factors, I'm sure as shit on a mitigating medication, a
Right.
pharmaceutical that, yes, is very controversial, but I'm also taking that in combination with another medication that will help. It's a 1-2 punch against coronary disease. And I've been on that for but I was very hesitant to do either of those meds. My nurse practitioner and I, she's my clinician, amazing person, Lori Love, up in Santa Clarita. Awesome clinician. She and I struggle with that decisions. Like, she was hesitant to put me on she's trained by, under Mark Hyman, understands and respects, goes down the functional medicine path. And I've been following her and following that for a number of years. It was like pulling teeth to get me to be on it. But finally I'm like, okay, I've got significant risk. I need to really start figuring this stuff out. So I went on a statin. And I'm also on, oh my gosh, ezetimibe.
But you say statins are controversial.
Uh-huh.
I mean, I believe it's the most prescribed medication in America.
Yeah.
And so I think the problem is it's not controversial enough that they're
Yeah.
still prescribing it so much.
Yeah.
And there certainly may be instances where it does make sense.
Yeah.
I mean, I remember I had gone to a new primary care physician.
Mm-hmm.
My cholesterol was, I think, 1 point out of range.
Yeah.
And he's like, given your age, we should, and that was the only data point.
Yeah.
We should put you on a statin. Like, hold on a second.
Yeah. People
You know?
knee jerk too fast, for sure. Absolutely. Yeah. There's side effects, right? And
Right.
not everybody tolerates them. And for someone with very little risk, why would you do that? Why would you put somebody at risk for those side effects? But we know that the two, ezetimibe and at least the statin that I'm on, that have substantially reduced my LDL-C. It hasn't budged my LP(a). Let's be clear about that. It doesn't do nothing for LP(a), that independent risk factor. There are meds coming out for that in the next year, 2 years. Pelacarsen, which is an oligonucleotide medication, it's phenomenal. You take it; it's an injection once a month. At least it appears to be phenomenal at this point. We'll see in big populations, but it's going to revolutionize people with that problem. You've also got medicines like Repatha, PCSK9 inhibitors right now. The study that I got last week, when I see my Clearly, if I see significant soft plaque burden, I'm going to consider, despite my primary care doctor, saying, hey, you probably don't need that medicine. I'm going to be inclined to potentially be on that medication because I don't want to die from heart disease. It's so easy to fix.
Right.
Why go down that path if I don't have to? And I know the risk. Why would me personally, not that I'm saying this is, medical advice for people out there, But because I'm not giving medical advice today, that's up to you and your physician. But for me personally, and my relationship with my MP, we'll cross that bridge when we get there. But at least I'll do it with informed consent and understanding, deep understanding of what's going on in my personal body.
I think informed consent is one of the big problems. I don't want to go down that rabbit hole too much, but what I would say is, what are the other things someone can do that has, some cardiovascular risk factors, whether they be genetic or just, their current state, that can really help reduce the cardiac risk?
Great question. And this is, I guess, to most people who don't necessarily have, let's say you do have some cardiac risk. You're overweight perhaps, or you're sedentary, or you smoke. You live in an area of the world where you have nothing but access to processed foods. Let's say you're that person living in that context. Then you just begin to mitigate each of those levers as best you can, right? So if you have access to good food, start there. Remove processed food from your diet altogether. Remove refined sugar from your diet altogether, and it's in everything in the form of high fructose corn syrup. It means understanding, like getting an education as best you can. We have the great equalizer now at our disposal, which is the amazing ChatGPT and Grok and all these AI is incredible. ChatGPT, I believe, just passed the USMLE Step 1 with 100%. Fact check me. I think it was Grok or Chat. One of the two just passed the USMLE Step 1, which is incredible to me. Which means
I'm not familiar with that. What is that?
The USMLE, the United States Licensing Medical Exam, it passed 1 or 2. I'm not sure, maybe both. But it passed the medical licensing exam with 100%, meaning it is damn smart. It's really good at handling medical questions now with very little, hallucination. So you can rely on it to a pretty large degree now, and you should certainly follow up with your physician. But you can get a very deep education now in nutrition by just asking Chat, hey, what are these things that I can do to reduce my risk? Chat is everywhere. Everyone's using it. It is a tool at our disposal. If you're not using it, it's like, why are we still in the dark? Why are we guessing at these things? We don't have to guess anymore. So, diet, my goodness, it's simple. So Mediterranean diet is, whole food. It's got plants, it's got meat, lean meats, ideally, fish, chicken, taking the skin off of stuff. If you're going to eat a bowl of rice, or a portion of rice, make sure that it has a healthy fat in it. Put a bit of olive oil in it, or coconut oil in it. Eat your vegetables first, rather than starting with your carbohydrate. These things help blunt the glucose spike. Once you eat, then eat your protein, then eat your simple carbohydrate, your rice last. Save dessert if you're going to eat dessert. Eat very small amounts and eat it after you've had your meal, of course. Don't start the morning with a high glucose spike. Wear a glucometer. We have continuous glucose monitoring now where we can check our glucose over time. It's super helpful. That was like an eye-opening experience for me. I put a CGM on.
You've used one before?
Yeah, it's incredible. You put one on and it's like, oh my God, I had no idea that this food does that to my blood glucose. And that's feedback. It's a feedback loop. It's like, I won't do that again because I'm really concerned about heart disease.
So
why?
Naive question maybe, but I know enough to know about glycemic index, the idea of how quickly a particular food turns to sugar in the body. But are you basically saying that maybe brown rice behaves differently in your body than it does mine?
It could, yeah. I mean, it's
in a material way.
In a material way,
yeah. Like could your insulin spike, assuming neither one of us has diabetes or anything like that, but could your insulin spike related to a bagel be materially different than my glucose spike to the same bagel?
Absolutely, yeah. So that's based on age. It's based on insulin response. Based on pancreatic function. It's based on peripheral tissue resistance or no resistance. So if I eat, if I have sugar in my body, my cells may take it up very readily because of a really a fast and effective insulin response. The uptake of glucose into the cell because I'm young and healthy. And I have a pancreas that just kicks out, just the right amount of insulin at the right time. And I'm able to blunt that really quickly. And I don't get those spikes as a younger person. And I'm active. Let's say I get up my walk 10, 15 minutes after I get done eating. Also blunts that response. And somebody who's sedentary, overweight, somebody who doesn't eat the right foods or the right timing of the foods, they're gonna have that spike. They don't know about it, and it could be detrimental to them, and they simply will not know. So yeah, it's based on the differences in us as human beings and where we're at in our lives and genetics and all sorts of things. So yeah.
So one of the things I was joking with some friends the other day when some of our friends at Lumati, and I was like, you say, oh well, this will decrease all cause mortality by 30%, and this will decrease all cause mortality by 40%. Like if you add them up, I'm apparently going to live for eternity because all cause mortality is reduced by 400% when you add them all up.
Yeah.
And so how do you demystify that to get to a place that, because like when we talk about Titan Arc and what we're trying to be able to do for these folks is give them a quarterback and a game plan where they have a clean understanding about where they're starting. We demystify it in a way where, hey, while the underlying data might be hundreds and even thousands of different biomarkers, gut biomarkers, all the different variable things you could be looking at, urine analysis results, stuff from your fitness tracker, you might have, high hundreds or low thousands of pieces of information that are demystified to maybe 5 statistics, a brain score, a muscular, a strength score, a cardio output score, so on and so forth. Maybe talk a little bit about how you view that and, kind of the direction we want to try to take people. Because I feel like the problem now is, if all you're going to give me is data, and even if you do all my testing and you say, well, here's what's good. And like I remember I think it was Gary Brecka was on Sean Ryan's podcast, and he had his blood work and he was going over what was good and what was bad and some things he could do to mitigate it. And while it was interesting, it was way too detailed for like 95% of the world. How do you think about taking that and simplifying it in a way that it's actually actionable?
That's great. We're going to have the amazing experience of dialing it as detailed or opening up the granularity as much as we want with our patients. But on the whole, I think what you and I have been talking about is this idea of a composite score for each of those areas, which you described. What were they the other day? Do you recall off the top of your head?
So it was like you've got a brain score, you've got a strength score, a cardiovascular score, maybe one for balance, one for mobility.
Yeah.
The things that, even some of that, I'm in my late 50s now, but even if I was in my 40s, like I remember, I think I was in my very early 40s and I took a very, very detailed cognitive test. So that I had a clean baseline. And then I could take those exact same tests when I was 50, when I was 60, when I was 70, so that it wouldn't be arbitrary. It wouldn't be anecdotal about, hey, has my cognitive function in fact declined? In what areas has it? So that if you're going to try to either mitigate things or even reverse some of the processes, what mechanisms are there, and to have it be as analytical as it could be.
That's great. No, I think that's a brilliant way to go about it. Simplify it for people to make it understandable and digestible. And it, but each of those components has, it's a composite score of many factors rolling up into that one score that we can give them, and quantify it in a way that makes sense. That's, consistent with what the literature for all those things compiled might look like. We're going to have to kind of, make that up, it won't be a composite score that's based on any known criteria that we've studied. And
at the end of the day, if what you're trying to do is you're trying to do something differently from how it's been done before, by definition, you don't have all the historical, sort of things to apples comparisons, right? At the end of the day, though, you do know that super high triglycerides, bad, right? Super high cholesterol, bad. Super high blood sugar, bad. Poor, liver or pancreatic enzymes, bad. Like there's things that are very, very obvious. And like tons of plaque in your arteries, bad. Like there's a lot of things that are very obvious, especially the things that are related to, the big three, right? Which to me is cancer, cardiac issues and diabetes, right?
Yeah.
If you can avoid those three,
Mm-hmm.
that's like what, 80%?
Yeah.
I mean, other than, and the only other big category is doctors and hospitals screwing up.
Yeah.
Right. That's the only big one left.
True.
Other than that, you got
Sure
like
enough,
poison
cheers.
ivy, is like next on the list.
Yeah. Yeah. No, that's great. I think that there's utility there for sure. And yeah, you're right. If you fix those three things, you've fixed, dementia, cognitive decline, heart disease, a whole cancer. You've reduced the cancer risk in that. So yeah, a lot of power in moving those things.
Let's talk about the cognitive decline, because that's another one that, when I look at some of the stuff that, what is it, Life Springs? I forget. Is that what the Anthony Robbins, what's Tony Robbins?
Oh yeah, Fountain Life.
Fountain Life, sorry,
Yeah,
Fountain Life.
yeah.
When I look at the stuff,
Peter Diamandis.
There's nothing there that I've seen
Mm-hmm.
that's around the cognitive, measuring cognitive ability in a granular way. Maybe there's something there that I'm not aware of.
I'm sure they do. They probably pull in either. I'm not sure, but I would be shocked if they didn't look at cognitive decline as one of those endpoints. They've got good teams and really smart doctors. I've heard a lot of them speak. I'm a huge fan of Peter Diamandis.
Mm-hmm.
Yeah. So I would be shocked and surprised if he and his team aren't looking at cognitive decline as part of that endpoint. But yeah, but you're right. I've never been through their system, so I don't know from personal experience what that's all about. But I have heard from people who've gone through there that they kind of miss the you get the information, but then they kind of miss the boat at times with regard to what do you do with that information when you have it. Perhaps that's a function of people buying less the lower package versus the higher package. I don't know. Again, I'm speaking with a bit of ignorance here, having not been through their system. Again, I'm a fan, not disparaging them. They do good work. Their intentions are in the right place, and they are using conventional medicine as well as non-conventional modalities. And all their physicians are trained conventionally. So, my thumbs up to what they're trying to do. They've set the pace, and we're going to compete with them. And so it should up our game. We should be thinking, okay, what are they doing, and how can we do it a bit better? How are they perhaps failing, in their attempt to do what we're essentially trying to do?
Let's talk about fitness trackers and whether or not that data is, because when I think about it, the only two numbers I ever really look at, and I some occasionally look at heart rate variability just because mine's like unusually low, and
Yeah.
I don't know. I'm like hoping one day it just miraculously increases, which it probably won't. But I look at how many steps I do, and I don't even know why. I already know whether I walked a lot that day or not without looking at how many steps I did.
Yeah.
Does it really matter whether I did 11,000 or 12,200 or 9,800?
Yeah.
No.
Yeah.
I look at how much sleep I got, how much deep sleep I got, and how much REM sleep.
Yeah.
Other than that, and again, I'm wearing a WAP. I'm wearing an Oura ring.
Yeah. Yeah.
I had an 8 sleep. And I'm like,
Yeah.
one, they don't give me the same information.
Yeah.
Sometimes they'll be off by an hour, an hour and a half.
Yeah.
And so I'm like, okay, well now which one do I use? And so I feel like even though I'm trying to have the measured life. I'm trying to be analytical and thoughtful. But, to me, it's like, okay, I know when I went to bed. I know when I woke up, whether I felt, rested or not. I know if I exercised. I know if I went for a walk. I know if I I don't know. I just feel like, and again, I'm as guilty as anybody.
Yeah.
And I feel like there's a lot of people that just say, for God's sake, can you give me the 80-20? Can you give me the 20% of the stuff I need to do to give me the 80% of the result? I don't want to be Brian Johnson, go to sleep at 7:30 every day.
Right.
And and measure every last calorie that I'm going to eat for the rest of my life.
Yeah.
Most people don't want to live that way.
Yeah.
I don't know. How do you think about that?
Oh man, that's the problem. I've thought about that a long time, a lot. And I'm a trained clinician. So, and I had to kind of come to the place that I'm at with my personal health through like trying this and excising that out of the regimen and whittling and constantly iterating on this. And a lot of it's guesswork. And there was a bit of frustration because there was no like one-stop shop that I could go to and say, just give me the 20% that I can do to move myself to 80%, right? And so that frustration led to like, I should really consider like solving that problem, making it easy for the vast majority of people out there that just want the answer. And they can trust that answer is accurate based in research, based in, tried and true methodologies. and it's a group think, a think tank basically of clinicians and professionals that know what the hell they're doing. And they certainly don't have all the answers, but they have worked really hard to try to, ride the cutting edge and understand it, what we can possibly understand at this point. They know, at least they're riding that bleeding edge. And so that, that frustration has led to, the idea of TitanArc, where we create something that is, holistic in approach, that is community-based, that is heartfelt. It's for men who are, ages 40 and above. And we're basically trying to mitigate their risk, help them understand their bodies in an intimate, very detailed way. It's for people with means, but that's not to say that we can't go down market with this once we have data. But we're here to serve patients with means because they're often underserved. Yes, they can go to their cardiologist, they have insurance or they're cash paid, and they can go to any subspecialist that they want to. We can surround them with that subspecialty as well within our context, but you'll be given a lot of time with these clinicians, and there'll be a sense of community and camaraderie. You can connect with other people within we're going to have retreats. It's going to be a brotherhood in a sense, which I'm super excited about, the sense of community and, commiserating or, championing each other. And in comparison, as much as people are willing to open up about their personal health and their journeys, terrific. If they want to stay, in relation with their physician and their physician only, great, we can provide that. But they'll have the capacity and the wherewithal to go super, super deep. They'll have, we'll be on speed dial, basically.
Yeah.
Answer any question.
Yeah. I also think that, like I was talking about AI, even if I just look at my own data, the information just related to me, between my tracking, tech, plus, my however often I have my blood work and urine analysis done. Maybe I wear a continuous glucose monitor once every 12, 24, 36 months, and I get updated information on that, seeing the differences between that. The reality is, even a well-trained doctor, that really is steeped in that, quite frankly, the level of data. So imagine you had every food that I consumed, say I wore it for a week. You had every single food I consumed, and you had that data over, once a year for 3 years. The ability to process all that information for any person would be really difficult. For AI, it's really trivial. And so being able to have actionable insights where you're able to take enormous data sets and distill them down to the things that are actionable and that matter, I just feel like that's something that there really isn't any great way to do it. And, people there are all these apps now. You can take a picture of your meal and it'll give you your macros and an estimate of the calories and how many grams of sugar and stuff like that. But even those things, it's like, how accurate is it? I know that when you hear about it happening fairly frequently, I use the example of the supplementation with the FDA, where 80% of the time what's on the packaging isn't really accurate. I've heard the same thing about when you're getting, a meal prepared, in a restaurant, just because they tell you what's in it, like, how is it going to know whether seed oils were used or olive oil was used in cooking something?
Great point. Yeah.
And so I feel like, it's, I don't know. I just feel like it's really, really messy. And I think that part of what I think we're trying to do with TitanArc is, how can we clean that up to the best of our ability and give it to people in a way that it's actionable. That's kind of what because if we can nail that and give people a great experience while they're doing it, and generally in a material way improve health outcomes, that's what people want. I mean, the people I know, we were talking about this the other day, my dad's 83. If he could pay $100,000 a year and know that he was doing the absolute best things he could possibly do to stave off cognitive decline, to keep his bone density, to keep his muscle mass, so that into his late 80s, early 90s, he could still travel and do basic stuff and be able to walk up a few flights of stairs and things like that. I don't think he'd hesitate. And I think there's a lot of people that fall into that category where the most important thing for them is to try to improve their health span and their ability. I mean, it was funny. I was doing a guided meditation the other day, and I had this repetitive thought. I don't know why. I'm imagining myself. I'm 100 years old, which would make my daughter about 65. And we just finished hiking like a 15,000 foot height peak.
Amazing.
And I've got a smile on my face. She's got a smile on her face. Like, that's what I think's possible if, if we can leverage the technology that's out there and, use AI in a smart way while still being high touch and providing that level of service that is going to make a difference to people.
Yeah, it's beautifully said. I couldn't agree more. That's exactly the goal. It's a worthy endeavor, man. It's going to be a lot of work and a lot of fun. I look forward to providing that. Yeah.
Yeah. So, maybe let's talk a little bit about, timelines. I mean, I think, at least from my perspective, what we've been talking about is having this up for our very first set of customers before the end of the year. Where are they going to be able to find TitanArc?
Online. So we'll have I've already bought the domain titanarc.com.
Yeah, titanarc.com. So please, folks, head out to titanarc.com. We're going to be taking in sort of our first set of patients here in the next 60 days or so. Really, in fact, I'm going to make sure that I'm a guinea pig too, because honestly, part of the reason I'm so excited about this is I want this for myself. It's like I want to be that 100-year-old guy who's still able to hike 15,000 foot, peak with my daughter, and she's able to do it when she's 65, because I feel like the youth is sometimes wasted on the young.
So true. There's a guy who actually climbed Mount Fuji, I think. It was in the news this week. 102 years old. Okay. He had done it before, done it two times before, like a few years before. Read the story. It's really fascinating. Super.
Well,
super
all
cool.
right. So now I got to do it at 105.
Yeah.
So, Dr. Handley, thanks so much for joining me.
My pleasure, Dave. Yeah, I look forward to the journey.